Hello, my name is Azalea Hancock Ward. As a candidate for the Doctorate of Athletic Training degree, I would like to present to you a quality improvement project on the development and dissemination of a sports medicine website. Dr. Valier has served as my advisor for this project. We will discuss the background, the problem, our measurement and design, which was centered around the PDSA cycle, the strategy, results, our lessons and limitations, our goals for future research, our dissemination efforts, and conclusions. The Board of Certification for Athletic Training has published standards of practice that serve as a guideline for clinicians and educators. Within the 7th edition of the BOC Practice Analysis, Domain 1, it details the role of injury, illness prevention, and wellness protection. Depending on the job or setting an athletic trainer may find themselves working in, they may have more opportunities or less to truly create awareness, education, and provide information on intervention as outlined in the practice analysis. Although the field of athletic training is growing in bounds, as of 2015, the access to a full-time athletic trainer in high schools was 42% for full-time access, and the percentages varied below that for part-time and as-needed basis, otherwise known as PRN or outreach. Currently, most of the information that is available about access relates to athletic trainers in high school settings. There has not been much, if any, documented research addressing access to athletic trainers in underserved communities, such as middle schools and the other percentage of high schools without an athletic trainer. Access to an athletic trainer will vary statistically, state to state, but this quality improvement project focused on a local community in the state of Georgia. While working as a full-time athletic trainer for the high school, I was exposed to the gaps in the current access and healthcare information available at the middle school as well as the high schools. Health education platforms can provide access to critical information when an athletic trainer is not accessible, and in turn improve community trust and further grow health promotion locally. The challenge is, how can an athletic trainer improve their efforts to create awareness, education, and provide information for populations and demographics that have limited or no access to an athletic trainer or a sports medicine program at their school? The reality of lack of support related to the health care of younger athletes highlighted the need for educational efforts to help inform non-healthcare personnel at the schools, such as coaches, administrators, and other stakeholders such as parents, on the best way to treat athletic injuries and related conditions. Ultimately, through this quality improvement project, we hope to narrow the gap to those with less access to healthcare professionals by assisting the community and better accessing information to support the health of athletes in the community. This quality improvement project was conducted by following the model for improvement, which includes a plan, do, study, act cycle. For this quality improvement project, a website consisting of health information was created and shared with a local community with limited access to athletic training services. The goal is not to replace the absence of an athletic trainer, but to show the value of having access to an athletic trainer, how to advocate for one at their school, in addition to filling the gaps in the Triple Aim framework for underserved populations. The Institute for Healthcare Improvement believes that focus on 3 critical objectives simultaneously can potentially lead us to better models for improving healthcare. In summary, those 3 aims are improving the health of a specific population, enhancing the patient experience, and reducing per capita costs of care. We know that all 3 of these are directly affected by not having the proper care when an injury happens or other health conditions. The efforts to create an avenue to educate stakeholders in the community about acute management of athletic injuries and conditions is needed, and this quality improvement project was targeted towards filling the global initiative gap in this area. Our study design centered around what are we trying to accomplish, what changes can we make that will result in improvement, and how will we know that a change is really an improvement? First, what we wanted to accomplish was within the current healthcare system, there is a significant gap in terms of healthcare access to the athletes at all levels of play in the community. The goal of this quality improvement project is to narrow the gap and assist the community in better accessing information that may help support the health of athletes in the community. What changes can we make that will result in improvement? Well, there are many potential changes and improvements that could take place. The most feasible improvement was the creation of the website to help narrow the gap of accessing information in the community. This platform for information sharing offers avenues for not only building trust within the community, but sharing health education information with those who do not have or have limited access to an athletic trainer. After creating a suitable website and building awareness about the site, efforts towards building community trust to gather feedback on interests and or concerns related to the website will be made. A primary long-term goal is to make sure that the information presented continues to identify with the community expectations and demographics. But what about improvement? The overall goal initially would be to use a survey to gather feedback from a small group of stakeholders, including coaches, parents, students, and administrators, with the understanding that the website is still under construction. Once the site is complete, we will analyze user statistics to measure change at monthly intervals. In order to measure the outcomes, it has been noted that integrating both qualitative and quantitative methods provides a more in-depth outlook on outcomes. The research highlights that evaluating the effectiveness of the health communication program is very critical in its effectiveness. Our measurement and design for the Quality Improvement Project started out with planning out what was the platform for the website and how we were going to attack a design. Once that was established, we were going to create and implement a website platform, promote it, and collect feedback via survey. Once we got feedback back from the survey, we were going to review the suggestions from the end users, otherwise known as the stakeholders. And then from there, we were going to act on that feedback to make the adjustments and continue to expand the dissemination efforts. During the plan phase, the initial plan included drafting a website, securing a website address, and registering the domain name once the name was established. Table 1 outlines the drafting of the website and brainstorming of the content and organization of key web pages for presentation of content. After a general draft of the content was developed, the most user-friendly website that had a hosting site was identified, and then the best template and color scheme was picked. The overall plan was to put a system in place that streamlined execution during the do phase. Some website hosting avenues are a little bit more complex than others, and so it's a little harder to try and figure out how to set up the website. So this was a very critical stage during the plan strategy. During the do phase, our target test of change and the focus of the do section was to design and create an informational website for stakeholders for the purpose of information sharing. During this phase, we took the content as outlined in Table 1 previously and began to create web pages. Once 3 to 4 pages were complete with content, the site, along with a brief survey, was shared with various stakeholders to get some feedback on the general look, feel, and content of the website. As you can see here, this is a screenshot of the homepage or part of the homepage of the website. The website is called Beyond Coverage HS, which stands for healthcareservices.com. During the study phase, a survey was created to gather feedback on the design of the website and general concepts. The survey was sent out to a small number of end users. Some of the questions that we wanted to know was, are the images and symbols clear, and do they provide an understanding of the information presented? Were the web pages easy to remember? That's important because if someone wants to refer out your website or refer you to a page, you want something catchy to where they can find the information. And then we asked on other things such as the overall appearance. Was it user-friendly? Any particular areas that they liked more than the others? And what information would they like to see more of? From our survey, here are some of the results that we gathered. Overall, as you can see, the website was well received. The images and symbols provided a clear indication of the content. People listed what they found particularly enjoyable on some areas of the site, which we'll discuss a little further in the next slides. The feedback from the survey was analyzed, and once again, it was overall great. One area that was highly favored was the free educational handout page, which highlighted the infographics that are available from the National Association of Athletic Trainers. These infographics are great, and many do not know about them if they do not have access to an athletic trainer. And so I thought it was very important to have this information available for them to download and share amongst themselves, their team, and the administration. There was also a page called Resourceful Links, which is still being added onto, but it included some links such as the Corey Stringer Institute, the Georgia High School Association, as well as the At Your Own Risk, which has some of its own great resources. For example, our next web page, called the Parents page, starts out with one of the great resources from At Your Own Risk, which is a parent checklist for youth sports safety. Many parents found this to be very resourceful because it gave them a checklist and questions to ask when dealing with their children and sports. After studying the feedback, we began making some of these changes suggested, such as including content to the athletes page and the advocacy page. Once again, as a reminder, we did explain to them that not all of the pages were done, and they understood that, but they were just excited to see what those pages had to bring. The website also will be updated to have a mobile-friendly viewing version. As you can see in this picture, this is a screenshot of what the website looks like from a mobile phone. Of course, this is something that will be improved and streamlined in the future. This was one of the concerns that was brought up on the survey. The goals with the next cycle will be to finish the incomplete pages and upload the remaining content outlined in the due phase. Once the site is complete, the survey will be sent out again to more end users to get more feedback on their overall website experience. Additionally, the goal will be to create infographics and a brief promo video promoting the website within the community and gathering more end user feedback. So some of our lessons and limitations that were learned. Overall, we aim to create a well-organized website with clear content and structure, much like suggested by Ford, etc. We do know that healthcare systems play a critical role in being a source of information for consumers. As a result, the need for social media presence to connect with consumers is growing quickly. Overall, the effectiveness of a website is based on its accessibility, content, marketing, and technology. 4 defines how each of these domains lead to a website's effectiveness and being able to meet industry standards. Accessibility not only refers to the website being able to find in a Google search quickly, but it also includes the website's ease for individuals with lower computer literacy levels. A website would effectively address the domain of accessibility by having information easy to find and comprehend, not flooded with features that require any additional software. In order for a website to be effective in the domain of content, it should be updated regularly, free of errors, encourage user engagement, and contain quality imagery, and a calculated reading age of the content should be appropriate and reflective of the end users. The marketability of a website deals more with the technical aspects in the website's design. The website should be accessible through search engines and have a measure of rank and popularity. Lastly, an effective website is measured from a technology scale based on the user's experience. Another lesson we learned is that a website creates an avenue for certain demographics to be reached that otherwise do not have access to the information. For example, many of the younger kids from grades 6 through 8 here in Georgia, which falls in middle school, do not have access to preventative information that could be very beneficial and foundational to their long-term health and athletic career. One way that this health promotion could benefit this population is to create promotional material such as infographics or small postcards to disseminate to demographics with less access to athletic health care. Another step in this project, or another lesson learned, will be to invest time in understanding on what influences and drives the prospective end user. In sports medicine, injury prevention, health promotion, the rate of adoption of the innovation depends more on the end user's subjective perception of the advantage. In sports medicine, the end users will most likely include, in addition to the athletes, parents, coaches, first aid providers, and administrators. Any health promotion intervention would have to address concerns from these end users' perspective. So what are our limitations? Well, one of the limitations related to creating a website is the cost to secure a domain name, which can range from $5 to $30, and the cost of having a host for the domain, which is a monthly cost in some cases, in addition to the costs or fees associated with the actual web development. The monthly cost for hosting a domain can range from $12 to $40 per month. The cost to secure a web developer can range from $100 onward and upward in the thousands, depending on the amount of content, the amount of revisions needed, and the web pages desired. During the website development, although I have some previous experience with website development, the decision to get the site funded and created by an outsourced company or doing it myself was a struggle. The original goal for the development was to get at a minimum to create an outline or layout for the website and gather information that will go under each of these areas. While creating the layout, I discovered that it was easier just to simultaneously add the information on the actual website myself. There are some website tabs that contain more developed content than others. However, through this creative development process, organization of content became clear, the number of pages needed was determined, and the gaps in content was identified. Another challenge was just time and gathering content. The process of either locating or developing content can be very time-consuming. Considering that there is not currently a huge team in place for developing content, This task landed primarily on one website developer. There is currently a lot of information already available to healthcare professionals, such as athletic trainers, to share with the public. However, it often goes unnoticed. For example, as mentioned earlier, the National Association of Athletic Trainers has conveniently provided many resources that are available to share with the public. The examples include many of the free educational infographics on various health conditions. A good portion of time was committed to seeing what resources were available, verifying any copyright concerns, and deciding whether or not developing unique content was necessary. Our dissemination efforts or goal now and moving forward will be to complete the website. Once it's complete, create an infographic promoting the site and create a video on Vimeo promoting the site. Then we will identify end users and additional stakeholders to send the information to. And at that point, we will send out the infographic and the video. In addition, we will also speak at different speaking engagements that include parents and teachers, organize small meetings with various athlete groups, and partner with local nonprofit organizations devoted to athlete safety. Maintaining a relevant and current website with the end user or the community of interest may help us increase traffic to the website. A strategic approach is to make sure to engage end users throughout the various stages of development and gather feedback from their perspective. In order for end users to adopt an innovation, it has to be practical from their perspective, and then it needs to be accessible. There have been great strides made towards developing this quality improvement project. The process thus far has shown that a lot more time is needed to develop the content in order for the site to be ready to share with the public and gather more results. Our goals for future research definitely include gathering more end users and spending more time analyzing analytics and collecting analytics. Analytics specifically refers to, for example, Google Analytics, which provides insight on visitor behavior, such as visits to the site, their average time on the site, and what they gravitate towards. In summary, the Google Analytics help answer the questions: how do visitors behave, where are they coming from, and what content are they exposed to or more gravitated towards. Initially, however, for this project, the efforts were made to obtain stakeholder feedback on the website design, colors, and content. The goal in the future would be to continue to update the website, gather end user feedback, and gather analytics on the website to drive performance and improvement. Thank you for taking the time to watch my presentation. Special thanks to my advisor, Dr. Villier, for her unrelenting support, and thank you to all of the professors a part of the Doctorate of Athletic Training at A.T. Still University, and to all the staff for their support over the years.